They are your local experts in orthopedics and sports medicine and rheumatology. Today, we meet an orthopedic surgeon passionate about sports medicine.
Whether you're bothered by arthritis or an injury, including those related to the fast-growing sport of pickleball, patients get a personalized approach based on their goals.
Hi, thank you for having us today. I'm Lauren with OSMS, and today I'm joined by Dr. Ziegler. He is a sports medicine fellowship-trained orthopedic surgeon with us at OSMS. Dr. Ziegler, thank you for joining us today.
Thank you for having me.
Yeah, so can we have you start off first by telling us about yourself? Why did you become an orthopedic surgeon?
Well, I'm a Wisconsin native, so I quickly developed a passion for the outdoors and outdoor activities, played year-round athletics throughout my childhood and high school. So that in itself combined to lead me into orthopedics and really develop that career path. Yeah,
no, that's great. So then what can patients expect from you as their orthopedic physician?
Well, really an individualized approach, and it's really a team effort. And when a patient comes to see me, I look at us as a team. And so each recommendation is really personalized depending on those patients' goals.
When you are treating your patients, what are the common injuries and conditions that you're seeing in them?
Yeah, I like to break that down into categories, and really there's three major categories that I see, and that's overuse type injuries, wear and tear type injuries, and traumatic injuries. An example of each would be overuse injuries are your sprains and strains, and that can range anywhere from shoulder to knee, ankle. And then with regards to wear and tear type injuries, we look at more things like arthritis, where someone may require ultimately a joint replacement, and then your traumatic injuries, which can be broken bones or fractures, all the way up to rotator cuff tears and meniscus injuries of the knee.
We've been seeing a lot of people playing pickleball this summer. What are the most common injuries that you're seeing from people who are playing pickleball?
So again, I see those three major categories just in the general population with pickleball. So you have your overuse type injuries, then you have your wear and tear type injuries, and your traumatic injuries. And I'll give an example of each. So for some of the overuse type injuries, certainly rotator cuff tendonitis is by far the most common in my opinion, or at least what I see in my experience. And then with regards to your wear and tear type injuries, usually it revolves around arthritis of the shoulder or knee. And that can be arthritis that's been dormant for some time and doesn't become symptomatic until one increases their activities, such as playing pickleball. And then, of course, with the traumatic injuries, certainly we think of rotator cuff tears and meniscus tears of the knee, but it's certainly not limited to that, and we see a variety of different breaks, including the wrist and the ankle, when someone may fall and break their bones.
So more so with the overuse injuries and then the breaks or the sprains, how can someone prevent those types of injuries when they're playing?
Well, a lot of it starts with good preparation, and one is to have good appropriate gear, and that mostly with pickleball is related to shoe wear. So having good shoe wear, knowing what your limits are, and allowing the body to rest and recover. Okay. As well as I would encourage a stretching program and a good warm-up program.
Those are great tips for everyone to know, of course. So if someone does get injured while playing pickleball, what are some of the treatment options that they may have for those injuries?
Well, first and foremost, I would start with stepping back. If someone's injured, more commonly than not, it's one of the first two categories. It's overuse, it's a wear and tear type injury. Unless you've had a frank injury like a fall, the first step is to step back. And then beyond that, anti-inflammatories, Tylenol, we call it the RICE method. It's an acronym, R-I-C-E, and that stands for rest, ice, compression, and elevation. And it's when those things don't work, or for about a week, is when you should begin to seek treatment.
Thank you again for coming and joining us today. We really appreciate all your education and tips. If you would like to schedule an appointment with Dr. Ziegler, you can do so by scheduling an appointment online at osmsgb.com, or you can also call our office at 920-430-8113.
All right, thanks. And OSMS has locations wherever you play pickleball, whether that's Green Bay, Marinette, Neenah, or Oshkosh.
As you just heard, you can make that appointment by calling 920-430-8113 or online. You can learn a lot more at osmsgb.com.